Hey everybody, welcome to the Mass Retirees Weekly Update. Today's Friday, October 21st. I'm Sean Duhamel. Thank you so much for taking the time to join with us again this week. Now, I've got some really important breaking news to share with all of you. Just yesterday, the State's Group Insurance Commission announced its health plan selection for the coming fiscal year. This is a really big deal. It's some good news for retirees. And before I get to all of that, however, let me first update you just on a couple of quick housekeeping items. First and foremost, today at 1 o'clock on Friday afternoon, we will be hosting our Teletown Hall meeting. Now, this is a members-only meeting. There are two ways that you can participate. One is simply by answering your phone. If we have your telephone number on record, you will receive an automated phone call from me at 1 o'clock. All you need to do is answer the phone, stay on the line, and you will be automatically connected to the meeting. The second way that you can participate is by calling in using the toll-free number that's published in our newsletter on page 3. It's contained on your membership card, and it's also contained within today's email message that went out from me first thing this morning. So if you're a member, all you need to do is call that number. You'll be automatically connected. Now, today's meeting, we're going to talk about all of the news relative to the GIC, the Social Security WEP situation, and a variety of other topics. We'll be taking questions from our members, and we also have a special guest speaker, our endorsed candidate for Lieutenant Governor and the current Mayor of Salem, Kim Driscoll, will be joining us at the beginning of the hour. She's going to provide a little bit of information on the campaign that she's involved with Attorney General Maura Healey, what they are hoping to accomplish if they're successful on November 8th, and then hopefully having some time to take some questions directly from our members. And remember, throughout our meetings, if you have a question, all you need to do is press 0 on your phone keypad. That will connect you with our staff here at Mass Retirees, and we're going to get to as many member questions as we possibly can. Now, the other piece of housekeeping information or news I wanted to share is that our November newsletter, The Voice, it's on its way to you right now. Many of you may have already received it by the time you see this email or this video message. It was mailed on Tuesday. Leading off, we have healthcare information followed by the latest information on the Social Security WEP and GPO efforts down in Washington, D.C. So the third thing I want to mention is if you're watching this video and you're not a member of Mass Retirees, please consider joining with us. Now, the only way you're getting this newsletter or participating in our town hall events or receiving my email messages every Friday morning is if you are a member of Mass Retirees. Now, our annual dues are just $38 a year. We try to keep them as low as we possibly can. We know that retirees are living on a fixed income. So if you are interested in joining or just learning more information about all of the work that we do, whether it's our advocacy or services or discount programs, visit our website, which is massretirees.com. You can join online. Right in the right-hand margin, there's a join button. Join with us, and hopefully you'll be part of a great group, and it's really strength in numbers. The more members we have, the more we can do on your behalf. It's really as simple as that. So in terms of the big news this week, and this is really good news, as most of you should know if you've been following this information over the last year or year and a half, you know that the GIC spent a considerable amount of time building up for the procurement process that kicked off this past spring. And part of that process included a number of meetings with Mass Retirees staff as well as with you to solicit your ideas and your opinions and your thoughts on what your health insurance benefits should look like. And I should also point out at the outset that if you are a local retiree receiving your health insurance benefits from whichever city or town or district that you happen to have worked for, and you're not part of the group insurance plan, what I'm going to talk about still applies to you in a roundabout way. As we've repeatedly tried to remind everybody, the policies and the decisions made by the state GIC can quickly become local policy. And just a week ago, I got an email from one of our members, and she asked me, why do we spend so much time talking about the GIC when she was a local retiree and insured through a Blue Cross Blue Shield plan, which is excellent coverage. Really, all of our members across the state have access to some of the best health insurance benefits and coverages at an affordable price, believe it or not, available anywhere in the country. But my answer to this specific retiree and to all of you is that the policies and the decisions made by the GIC can very quickly become local policy as well. Local leaders look to the GIC for guidance, and state law allows local entities to very quickly implement GIC lookalike plans and plan design structures, really with little to no input from local retirees or the local unions. And this makes what happens at the state level with the Group Insurance Commission that much more important. So the announcement yesterday followed many months or more than a year of preparation, and then since the RFRs were released back in the spring, about 5 or 6 months of reviewing and scoring and interviewing to come to the decisions that were announced on Thursday morning. And the good news is that by and large, not a lot is changing. There's been some minor changes. I'm going to get to those in just a moment. But in terms of Medicare, and remember, most retirees who are over the age of 65 are eligible for Medicare. We realize fully that that does not apply to everybody. The GIC insures about 10,000 retirees who are over the age of 65 but are not eligible for Medicare. And that's strictly because up until 1986, Massachusetts, just like the situation that exists with Social Security, did not participate in the Medicare plan. So unless you had some private sector work experience or you qualify for Medicare through a spouse, you wouldn't have necessarily been eligible for Medicare or Social Security. So we have 10,000 retirees insured through the GIC who are not eligible for Medicare and are insured under the same non-Medicare plans as the active employees. And we are working with the GIC to encourage the GIC to implement a Medicare buy-in program where these 10,000 retirees could be made eligible for Medicare by the state buying its way into the plan. That's something that will be a heavy focus of our association heading into 2023. Now that the procurement process is coming to an end, it opens the door for the GIC to be able to work on a Medicare buy-in plan. So for those of you that this applies to, stay tuned. It's something that's important that we're going to continue to focus on, and we'll have additional information for all of you once it's available. But for those of you who are insured through Medicare, the good news is that not much is changing, if anything, when it comes to your insurance benefits. First and foremost, Unicare, the carrier of the state's optional Medicare extension plan, has been renewed. 70 some odd thousand retirees belong to the OME plan. It's the most popular plan out of all of the plans offered by the GIC. Unicare, of course, is headquartered here in Massachusetts, up in Andover. They're a subsidiary of the National Anthem health insurance plan, and our members who were insured through Unicare, which previously was the John Hancock plan, and this goes way back into the 1980s, are very, very satisfied with the coverage that they're receiving through Unicare, and particularly under the OME plan. So we were very pleased yesterday morning to hear that Unicare has been retained both as a Medicare supplement plan provider as well as continuing to offer health insurance benefits to non-Medicare retirees as well. But in addition to Unicare, Health New England and Harvard Pilgrim Healthcare will continue to offer Medicare sup plans under the GIC. Tufts Health Plan will continue to offer a regional or a localized Medicare Advantage plan. Now, the GIC had considered expanding its Medicare Advantage offerings to a national carrier, whether it be Aetna or United Healthcare, both of whom submitted bids to offer a national Medicare Advantage plan. The GIC at the present time opted not to pursue that option. There appears to have been a concern that at this time It just wasn't really ready to be implemented and could have resulted in a lot of upheaval and confusion and disruption for retirees. So we appreciate the GIC's cautious approach when it comes to making benefit changes, and it's something that we look forward to continuing working with them on in the future as plan selection either expands or contracts. But for now, the 4 Medicare supplemental plans or Medicare Advantage plan that are offered will continue to be offered. On the non-Medicare side, there have been some changes that will or could impact retirees living outside of Massachusetts. Right now, Unicare Basic is the health insurance plan for those retirees or active employees living outside of the New England area. Starting on July 1st, the Unicare Basic plan will be replaced by Harvard Pilgrim Healthcare's national network plan. The HPHC plan has been selected for a few different reasons. One, they have a very robust network. They utilize the United Healthcare national network, which is extremely robust. But more importantly, one of the comments and concerns that the GIC received from our members who are living outside of Massachusetts, particularly the thousands of members who are living in states like Florida, was in terms of the GIC providing a more cost-effective or affordable option for those retirees living outside of Massachusetts, particularly those retirees who are not eligible for Medicare. The Unicare Basic plan is a fantastic plan, but it is one of the most expensive plans offered by the GIC. So it's our understanding that the Harvard Pilgrim plan, as a national network plan, will have a more affordable monthly premium attached to it. And by the way, we won't know until early next year, in either January, February, early March, of what plan design will look like in terms of copayments and deductibles, or what the monthly premiums are going to be for any of these plans. That information is not yet known. Again, we will not have answers to those questions until January, February, and early March is when those pieces of the puzzle will fall into place, so to speak. So the good news is we know what the plans are, we just don't know all of the details associated with it. So in terms of the non-Medicare plans, the GIC has broken things down into 4 different product configurations or buckets. One being a national plan, that's the Harvard Pilgrim Health Plan, a broad network option that Always Healthcare provides or falls under. Harvard Pilgrim Healthcare also is a broad network plan, and the Unicare Basic plan that is very popular with our non-Medicare retirees is also considered a broad network. In terms of a regional plan, we have Health New England continuing to be offered in terms of a regional plan. And then in terms of a more limited network, which typically is more of an HMO type of product, we have Harvard Pilgrim Healthcare along with Unicare being offered. And again, all of the details of exactly what these plans consist of, who's eligible, what their prices are, what the copayments and deductibles might be, the plan design details will not be known until early 2023. So stay tuned, but the good news is that we haven't witnessed any wholesale changes. If you look back of what happened 5 years ago, the last time the GIC went through a procurement, the initial announcement of a consolidation of several plans potentially could have caused a lot of upheaval. And the GIC has not repeated that mistake, not that we expected them to. They put, again, a lot of time and effort into preparing for this procurement and gathering as much input from stakeholders like mass retirees and our members as they possibly could. And I think because of that, what we're seeing today is a pretty positive outcome in terms of the plans that are going to be offered heading into next year. But the next steps of this process, starting at the November meeting of the GIC, some discussion will begin around plan design, what health insurance premium trends may look like. And what we're seeing right now, across the entire healthcare marketplace with the potential exemption or exclusion of Medicare retirees is that we're seeing a spike in medical inflation once again, which is a huge concern for all of us. And that medical inflation, thankfully, seems to be more geared towards private sector plans and active employee plans rather than retirees and specifically Medicare plans. But we'll start to flush out, or the GIC will start to flush out the details of this starting at their November meeting. Then at the December meeting of the GIC, it's anticipated that the selection process of the pharmaceutical benefits managers, the PBMs, will be announced at the GIC's December meeting. And at that point, we'll have a pretty strong indication of what the benefit structure is going to look like before announcements are made at the January, February, and March meetings in terms of out-of-pocket costs and what the monthly premiums are going to look like. So again, thank you for tuning in. If you are a member of Mass Retirees, I hope you join us this afternoon at 1 o'clock for our Teletown Hall meeting. If you're not yet a member, please go to our website, and if you haven't received it already, you'll be getting this newsletter in the mail over the next few days. But again, thank you so much for tuning in, and I will be back to you again next week. Bye-bye, everybody.